One of the common causes of back pain or anterior hip pain is injury to the iliopsoas muscle. So we have some big strong muscles cutting through the side of the hip, coming down to the front to attach onto the femur. These are the strongest muscles for hip flexion that we're going to see. We can find the iliacus muscle that starts on the ridge of the iliac on the front side. It comes to fuse with the psoas muscle down on the femur. If we track the psoas back up, we can see how it goes to the lumbar spine. If this muscle goes into spasm, it starts pulling down, can cause further stress and strain on the joints in the low back, creating injury, more pain, that stiffness, kind of tight feeling like you can't loosen up. We'll see a lot with those. A severe psoas spasm causes severe amount of pain where people can hardly move. Things that we want to work on are loosening up the spasms, get some more flexibility in there. That'll help take the stress and strain off the low back. When these are running injuries, we tend to get a lot of muscle tendon irritation on the lower aspect. One of the problems that we get is as these muscles are attaching down, it's right in the same region of the femur, the quadriceps. We have a lot of strong muscles pulling up through here. Trying to get this area to calm down and relax can be difficult, especially if a person continues to run or lift. We have small nerves cutting up underneath through here. The wrong irritation and injury to the iliopsoas can create a lot of inflammation, which can compress on the nerve, and people start feeling a change in sensation in the hip, down the leg, in its nerve distribution pattern, and that's really coming from an injury to the big muscle groups up on top. These are ones also that tend to tighten on people who sit, especially at a computer or driving for long periods of time. They really feel that when trying to do a lunge type stretch. We really need to get better hip flexion and movements in people, especially with chronic low back pain. So we spend a lot of time working the quad, the front of the hip, with low back pain and injuries.